Hi, welcome to our podcast today. As you know, I'm Donna, the Director of Facilitate Consultancy, and we have been working with colleagues in ICS.AI to test their smart notes capability within the context of social work practice. So, as experts in your field, would you like to introduce yourself?
So I'm Zen Yusuf. I'm a qualified registered social worker and have been for over 30 years. And I'm an associate at Facilitate.
I'm Natasha Turner. I'm also a registered and qualified social worker for the last 15 years. And I'm here today, as Zen is, as an associate of Facilitate.
First and foremost, tell me a little bit about what you knew about AI generally, and then follow up with a little bit about in the context of social care.
Donna, I knew very little about AI, and it did scare me a little bit, especially within social care, because I've heard about it in other sectors using, but I hadn't seen it or could really think about how it would be used in social care. So yeah, I was a bit nervous when first asked, I'm not going to lie.
And what kinds of concerns did you have? Tell me a little bit about what concerned you within the context of social care.
Yeah, I mean, for me, around the confidentiality aspect, really, especially in children's services, we're going out doing child protection visits, having very sort of confidential meetings. So that was my first sort of concern using AI.
Yeah, I would agree. That was very much so. And then it was also like, well, okay, so we use this. How is it going to be stored? Where's the consent in this? And how are we going to kind of make sure that, that we follow the GDPR rulings around that?
What were your sort of initial reflections on first sort of picking up the tool?
Yeah, I mean, I was really surprised because we didn't have any training and we were kind of left to our own devices. It was quite easy to navigate.
All the sections on there, they're quite self-explanatory. So you can actually, maneuver around the site quite easily. Yeah. So for me to be able to actually get onto it and actually use it was a big thing.
What did you actually do? What did you input? And what were some of the outputs?
So I recorded myself to start off with. I kind of had a case study in my head of a visit and sort of read out aloud and just saw if it did a transcript of it, which it did perfectly.
We tried it with more than one person as well speaking. So in a meeting. And considering we've all got different accents from different areas, so we've got different accents, it picked it up.
And even uploading documents, some really long documents, like we uploaded an anonymous education healthcare plan, and it was able to pull information out of that, to summarise that. And that was a hefty 50-page document that it was able to do in minutes, really.
Mm-hmm. Tell me a little bit about how you think this can really support social work practice moving forward.
When you think about a social worker, you've got a caseload, you're going out, you're doing your visits. And in order for it to be person-centred and for it to be able to capture everything, you really need to concentrate on your conversation. It's really important to get that engagement. You can't always do that, though, because you're making notes, aren't you? And you're like, trying to capture key points and things. So that concentration goes, that connection goes for a short while as well. With this, if you've got their consent, you've got accuracy there, and it saves all that time of scribing, and you can make that connection and really build that rapport and relationship with the person that you're working with. From a personal experience, when it was my mum, I'm wondering, what are they putting down? What are they writing? Have they actually captured what I'm trying to say or what mum's trying to say? Whereas with this, you can actually let them listen to it as well. So then you make sure you've captured it correctly. So it's really smart. You can ask questions and it will pull from the information that you've kind of uploaded. It will bring that out. And I think that saves a lot of time for social workers.
I think one of the things that I found most helpful in terms of the tool is that evidence and the voice of the person. Working within the context of social care, the voice of the person is absolutely paramount. And whilst I'm reasonably confident that happens within the context of social work, what we generally find when we do quality assurance processes is that the voice of the person hasn't formally been documented or evidenced. So there's either an omission or there's a more generic view of the individual, whereas this really provides a concrete evidence base that you've captured the voice of the individual because it's formally recorded. It's recorded in their words, and then having that reflected in the assessment process, I think can only strengthen the quality of the assessments moving forward. We're talking about time saving, and I think this is not just about a time-saving opportunity, although I do feel it brings many time-saving benefits. I think it's about also sort of the the general practice and assuring decision making and evidence and professional judgment. Can you tell me a little bit about that?
I think we've touched upon that, how the system lets you sort of pull things out of bodies of text, so visits, and ask, and lets you ask questions to sort of look and review sort of visits and the evidence that we've got in order to make decisions.
Everything has to be evidence-based, doesn't it?
It does.
And when you're trying to put, especially if you're trying to put in a package of care for somebody, you've got to have that evidence, and this allows you to do that.
So do you think you could sort of, if we think about quantifiable time, what would be your views, Natasha?
Yeah, it is difficult to quantify, because when I was thinking about this, when I was thinking about all the information I've got to pull together, in a working day, it probably takes a full day. If you're put in to do a full assessment of a family, a single social care assessment, I think this could easily half that.
Well, I absolutely support all of the things you've said, having also engaged in the use of it, but also preparing for supervision as well, in terms of being able to go into that supervision really prepared, and being able to explore some of those challenges that you might be facing with a particular family or a particular individual, so that you can also be supported. I'm really keen to see how this moves forward. Well, thank you. It's been great, and I would like to thank you for the time and effort that you've put into reviewing the product, and look forward to speaking to you soon.